Have you ever thought about how humans are a lot like cars? Think about it. Every car is built with the same basic structure: an engine, a battery, a fuel system, and so on. But just like cars, humans have different systems that can go wrong. Let's say a car's fuel pump goes out. You wouldn't send it to a mechanic to change the headlights, right? That would be ridiculous. Each problem requires its own specific diagnosis and treatment. The same thing applies to our mental health. Humans have psychological components, emotional, neurological, behavioral, that can fail in different ways. For example, someone with depression needs a completely different approach than someone struggling with narcissistic personality traits. But often, we treat all mental health issues as if they can be fixed with the same toolbox. Take group therapy. For a person with depression, group therapy can be incredibly beneficial. It provides a sense of connection and helps them realize they're not alone. But for someone with narcissistic tendencies, group therapy could actually make things worse. They might dominate the conversation, manipulate others, or use the group to fuel their own ego. They would thrive better in a structured program, like a 12-step program, where they're held accountable in a different way. Now imagine if we forced both people into the same treatment setting. It's like asking a mechanic to replace a car battery to fix a headlight issue. It doesn't make sense, and it can even cause more harm than good. Research backs this up. Studies show that tailored treatment approaches lead to better outcomes. A 2020 study in the Journal of Clinical Psychology highlighted how therapy for depression often benefits from a focus on connection and emotional processing, while narcissistic personality disorder requires more structured, directive approaches like schema therapy or dialectical behavior therapy (DBT). And yet, in practice, we sometimes lump everyone together as if mental health is a one-size-fits-all problem. But mental health isn't that simple. Just like cars, we're complex. The solution? We need to take the time to diagnose and treat each issue individually, with care and precision. Because treating someone for the wrong issue isn't just unhelpful, it can actually make things worse. So next time you think about mental health treatment, remember this: you wouldn't fix a dead battery by swapping out the headlights. Let's treat people with the same care we'd give our cars. Diagnose the right problem and apply the right solution.